Ready? Okay, give me a count. 3, 2, 1. Welcome to this press conference here to support Kristen Wong-Tam's bill, the Gender Affirming Healthcare Advisory Committee Act. And the reason we're here, of course, is to speak up for the gender diverse and their access to healthcare. Years ago, in fact, 2012 was when trans rights became human rights in this province with Toby's Act, but that hasn't held where healthcare is concerned. So we need full access. Part of the gender affirming bill is to have members of the gender diverse community provide information and consultation to the Minister of Health, Sylvia Jones, and to create a report 6 months later to the minister and then have her act on that report. That currently is not happening. And I'm delighted to have with us folk to speak to that issue and to the bill. First and foremost, we have Nikki Ward. She's advocate and president of Canada's largest co-op. She's also the former vice president of the health insurance company. She designed and implemented health insurance for 300,000 members of the Canadian Association of Retired Persons, CARP, as you may know it. And also, we want to show that this bill has not just NDP support, but broad range support. Nikki ran for the Green Party, and I'll then introduce Emma Wakelin, who is next to her. Emma Wakelin was a staffer here at Queen's Park and is a campaign manager for the Liberal Party of Canada. And lastly, we have Jake Pine. Jake is a professor at York University. Jake will be up after the two women speak. And Jake is a researcher where trans health and other trans and gender diverse issues are concerned. And of course, finally, the author of the bill themselves, Kristen Wong-Tam, will answer questions and speak too. Nikki.
Thank you very much. Good morning, my name is Nikki Ward, and I'd like to speak to the issue of Bill 42, Gender Affirming Healthcare Advisory Committee Act. There's a couple of things here that I bring perhaps some unique insight to. Firstly, as a former insurance executive, I know that health insurance decisions are both based on compassion and economics. And the bottom line here is that an advisory committee providing expert, good advice inevitably will create better decisions for all Ontarians. This simply makes economic sense. Not only have we, in essence, a two-tier health system, something I think we all agree we should not have because of the gaps in healthcare, but this is costing our government and our taxpayers a fortune. All we're suggesting here is that we establish an advisory committee from those people with lived experience, expert experience, to help the government provide better health care and to do so at a lower cost. And I hope that's something we can all agree on. Thanks very much.
Thank you, Nikki, and thank you, Kristen, for putting this bill forward. I can only speak from personal experience as both a trans woman who came out about 6-7 years ago, and as a staffer here at Queen's Park for way too many years. I can tell you that for far too long in many areas of the government, decisions are made by advisory committees that are not necessarily representative of the community, and that is sadly the fact when it comes to gender diverse people. When I came out in 2018, I was lucky. I had a job here at Queen's Park. I had fantastic benefits, but yet still with all of that privilege, I ended up spending most of my life savings just trying to be who I am. There are many thousands of trans people across this province who don't have the resources to be able to live their authentic self. And I think it's incumbent on our government to ensure that we listen to their voices, ensure that healthcare is universal across the wide spectrum of our population. So I thank Kristen for her bill. I really urge all parties, including our Conservative government, to ensure that gender diverse people are represented in the advisory capacities, the committees that advise the health minister in the government. Thank you.
Thank you. Jake.
Thank you. I'm Dr. Jake Pine from York University, from the York University School of Social Work. And I want to first thank MVP Kristen Wong-Tam for putting forward the private members bill, Bill 42, which will improve access to and coverage for gender-affirming healthcare in Ontario. The bill has been seen in the House before, but it finally needs to be acted on now. And one of the key issues is wait times, which is what I'll focus on. Last year, Ontario family physician Dr. Kate Greenway spoke publicly about her own 2,000 patient-long wait list. And she explained that, in fact, wait times are currently the norm in Ontario, that is not the exception, and that those gaps are in every part of the province and not just in smaller areas, which would also be a concern. She says it's in every part of Ontario. She reported on some of those wait times being 6 months to 2 years in general, 2 years for a pediatrician, and multi-step process for surgeries, and thus a worse wait time process, needing to wait for a provider who would request the surgery, then waiting for OHIP to approve that surgery, roughly 6 to 8 months, and then waiting for a surgeon, which could be a 3-year-long wait list. And in addition, needing to leave the province, as some do, is expensive and burdensome. Even in the most crude analysis of the situation, if we were to look at only the economics, it is expensive. It is expensive to the province to not give people what they need. It's expensive in terms of the other services that those people then require when they don't get what they need, which I'll move on to. But first, I wanted to say that we currently don't have accurate numbers of provincial wait lists is a feature of the problem that we're here to talk about, and what Bill 42 will try to address is that we need access to those numbers, and the advisory committee that MPP Kristen Wong-Tam proposes to put together will help this. So I have 2 points about wait times. The first is that long wait times are dangerous, and the research that's documenting that isn't new. It's now more than a decade past the release of the Ontario Trans Pulse Studies 2013 finding, which found that when trans people are ready to take that step for gender-affirming care, but they haven't yet begun, they're 27 times more likely to have attempted suicide within the past year. And we're now more than a decade past that time. So it's more than time for this. So the time between the trans person making the decision to access gender-affirming care and getting access to that care is then a dangerous time. It requires a timely response. And my second point about wait times is that wait times are also an expression of power, the expression of citizenship, of unequal citizenship in this province. So those who can access what they need versus those who are made to wait occupy unequal places in this society. Speaking about the same wait time problem in the UK context, legal scholar Emily Grabham writes that waiting implies submission. And gender-affirming care is not a minor detail. It's fundamental to people's lives and their ability to live their lives, to access our public institutions, which in this province, healthcare is meant to be universal, and yet we find that it is not, and that those wait times are worse among people experiencing other forms of inequality. For example, race, class, disability, status as a sex worker, etc. So I'm going to leave it there, but I will just note that the forming of a committee is not unusual in any respect. That is like this is common in the course of government business, and what this bill will do is simply prioritize trans people among many Ontarians who need better health care, prioritize this group of people for rectifying an inequality. So thank you again to MPP Kristen Wong-Tam.
Thank you, Jake. Thank you. Happy to answer any questions that there may be. Obviously, the Gender Affirming Healthcare Advisory Committee Act is not a new bill, not at Queen's Park. We've seen this bill before introduced in the last House session. It did receive the support from the Conservative caucus, and it made it to committee where it did not move any further. And of course, we then moved on to a June 2022 provincial election, and that bill then died. I'm hoping that we can see the support of all parties coming together, as noted by all the speakers. Having an advisory committee comprised of medical and scientific experts, as well as healthcare professionals and those with lived experience, is not anything new. But we do want to ensure that all Ontarians, every single one of them, has access to the healthcare that they need and deserve, and that includes trans and non-binary people. Happy to take any questions. We've got speakers here, and of course, we also have Sherry DeNovo.
So since the last time this bill was introduced, the province has, well, I guess gender affirming care has become a bit of a political issue across the country. We have the province, the PC, sort of like making motions in that direction, talking about teachers indoctrinating students, stuff like that. Do you think the PCs will support it this time, given the change in like the political situation around this issue?
That's an excellent question, and one that deserves a thoughtful answer. In my conversations with Conservative Caucus members, they have mentioned the fact that their federal leader, who is making all those comments, very much disturbing comments that are oftentimes hate baiting, they have mentioned the fact that this bill will not necessarily be supported by the federal party. However, we're talking about a different party here in Ontario, albeit they're provincial cousins, and if they do not support the bill at second reading, it will be quite telling. Honestly, because they did support it last time. So the only thing that would have changed is that the climate of the country is that we have a debate and one that's framed around gender ideology, which is a falsehood. This is a fictitious debate that's oftentimes created as a wedge issue. But real lives, Ontarians deserve to have access to high-quality, publicly funded healthcare, and that includes those who are trans and non-binary.
I am curious about what everybody makes of the PC's approach to, I guess, trans issues in general. We had, like I mentioned, we had that one time that Premier Ford talked about students being indoctrinated by their teachers, but really nothing came of that. Like the government didn't actually tell the students to, like the school boards to start informing parents about changes in gender identity. We saw the premier and the health minister very unambiguously say they won't be doing the same thing as like Alberta and Saskatchewan in reducing gender affirming care for like minors. So on one hand, they sort of seem to be talking a little bit, or at least dipping their toes in the water about this issue, and then completely avoiding it on the other hand. And I was just wondering what everybody makes of that. Like, is that a good sign in your mind, or what do you think?
I just wanted to respond to that because Toby's Law was my bill. Fought for many years to bring that in, and it was passed by all parties. And that gave trans rights as human rights to this province, and then, of course, spread across the country and became federal eventually. And I just wanted to give a shout out to Christine Elliott, who was a deputy premier of this province, who was one of the co-signatories on that bill. And later, the Trans Day of Remembrance was co-signed again by a Conservative, and that was Lisa MacLeod. So we had a number of Conservatives that have supported this, and this has been part of their policy as a party. So there's hope here, and I just want to put that out and say thank you to those Conservatives who will vote for this. I hope there are many, and also to those who have voted for trans rights. Thanks.
May I speak to that? Well, thanks for that question. And as an advocate of over 25 plus years of working across party lines for trans rights, I'd like to point out that this isn't about gender. This is about health care, which affects all Ontarians equally. What we're saying is that the current system does not provide good quality health care to a certain segment, and that the government should reasonably take good quality advice. So framing this as a trans issue, as others have said, is a wedge thing. The fact of the matter is all Canadians, all Ontarians vehemently agree that we should not have a two-tier system where one class of people get health care and another do not, even those people we may disagree with on political side. The history of the province of Ontario here, and again, as Sherry DeNovo said, has been that all governments, all parties in the province of Ontario have recognized the need for reasonableness in this area. And it's completely unhelpful to the trans community to frame this as trans and divisive. It has to be considered first and foremost as about providing equal access to health care for all Ontarians. And that's something that's worth reminding all parties of. So it's a good question.
Any other takes on the PC's sort of approach to these issues?
Well, if I was a cynical person, I would say that the federal party is looking for ways to shore up their base, and that they are so far ahead in the polls that they don't need to necessarily be attractive necessarily to more centrist voters, where that's not the case in Ontario. At the end of the day, there are two different leaders, the premier and the leader of the federal opposition. I don't think they're similar in their ideology. I think Mr. Poilievre comes from a part of his heart that is very hard, very anti-queer, and I think that he is allowing hateful ideology to fester in his party, to the detriment, I think, of our country. Thankfully, I don't think the provincial Conservatives have gone down that route just yet. Ontario is a little bit more centrist in its politics, and I think the provincial Conservatives are trying to be a little bit more careful in that regard.
Nikki, you're trying to, you're making the case that this is like a healthcare issue. Then,
Absolutely.
If that being the case, then I don't know a lot about gender affirming care.
Sure.
I know there's hormones, and I know sometimes there can be surgery, but if that is the case, and we're talking this is about healthcare, doesn't then this need to be taken to balanced against like the accessibility of like healthcare for like hip replacements and other things? Like the health system is very stressed at the moment, and there's
Right.
less resources, and the government is trying to cut down on surgical waiting times for like diagnostics for like cancer and people living in pain because of joint replacements.
Right.
Why should gender affirming care be prioritized?
Well,
over
that's
those
not what the
things?
Act is about. The Act is to establish an advisory committee so that the government makes better decisions about how it allocates resources. And to your very well made point, the fact of the matter is that trans people also need hip replacements. And there is a barrier to that level of basic care. Telehealth, for example, all Ontarians need to access, but there are institutional barriers to that are not obvious unless you've got lived experience, but are relatively straightforward to fix, all of which serve our needs to provide compassionate healthcare and, moreover, are more cost-effective ways of delivering those services. Once again, I come from that background. I recognize it's compassion and economics, but this particular act, as advisory committee, covers both elements very, very handily. Setting up the quality of one's decisions is based on the quality of advice one receives and, by the way, takes. And to circle back again, this government has been in some cases, reasonable, particularly when it comes to looking at the bottom line and preserving the needs of our entire society and also the taxpayers in general.
I just want to add to what Nikki has just said. Not only do we not want to establish a two-tier healthcare system in Ontario where you have one group that has direct access and fast access and one group that has less access or no access, you also don't want to establish two groups of people in Ontario where one is prioritized and one is not. Establishing this committee simply brings attention to the fact that there's a group of individuals highly vulnerable in Ontario that have very little to no access. If Ontarians are already feeling the struggle of a healthcare system that's already strained, now put yourself in the shoes of those who are trans and non-binary. That is even harder. So it really is about bringing forward concerns that the community has been raising for a number of years into the decades now, and then making sure that we are able to intelligently move on recommendations at the discretion of the Minister of Health after a group of experts have come forward and provide their very best professional advice. It ultimately still is in the discretion of the Minister of Health on how she decides to move on it.
Jake wanted to say something.
Yeah, I just want to Mr. Marks, your question. Thank you. I think it's really important as to your question about the Ontario healthcare system already being overburdened. I think it's important that we don't forget that it has been reported this year and last year that the Ontario provincial government is underfunding our healthcare system to the tune of, I'm forgetting the exact amount, but it was a very large number, 700 million, something like that. We can all look it up, and that fact should be appearing in every conversation that we have about healthcare in this province. And in terms of what is being proposed today, it's not radical. It's not controversial. These are settled issues in terms of universal health care, human rights, trans rights or human rights in Ontario. Those things have been settled already. So this is the logical next step: is that once we name a group as equal, then what are the barriers that can persist beyond that? We find out by putting together a committee like this.